If you or someone you love has started one of the new weight loss medications after turning 60, there is something many doctors are now paying closer attention to, and it has almost nothing to do with the number on the scale. These medications have helped millions of people lose significant weight. But heading further into 2026, more doctors are asking a different question. Not just how much weight is being lost, but what kind of weight. Today we are going to talk about why that question matters so much for people over 60, and what you can actually do about it. Weight loss medications like semaglutide and tirzepatide, sold under names such as Ozempic, Wegovy, and Mounjaro, have changed the way many people manage their weight and their blood sugar. For a lot of people, they have been genuinely helpful. But as more older adults use these medications, researchers and doctors are learning something important about how the aging body responds to rapid weight loss. Before we go further, a quick reminder. This video is for educational purposes only and is not a substitute for professional medical advice. Please speak with your own doctor about your personal health, and especially before starting, stopping, or changing any medication. Here is what is happening in the body. When you lose weight, your body does not only burn fat, it can also break down some muscle for energy, especially when weight loss happens quickly. This is true for anyone, at any age, but it becomes more important after 60 because the body is already naturally losing muscle as part of getting older. Doctors have a word for this natural, age-related muscle loss. It is called sarcopenia. On its own, aging can reduce a person's muscle mass by somewhere around 12 to 16% over the years. That is already a meaningful amount. So when rapid weight loss adds even more muscle loss on top of that natural decline, there is less room to lose before it starts to affect daily life. Muscle is not just about appearance or strength for its own sake. Muscle helps you get up from a chair, climb stairs, keep your balance, and avoid falls. It also plays a role in blood sugar control and overall metabolism. So, when we talk about protecting muscle, we are really talking about protecting independence. Let me give you a picture of how this can show up. Imagine a man named Robert. Robert is 68 years old. He has type 2 diabetes, and his doctor started him on a GLP-1 medication to help manage his blood sugar and his weight. Over about 6 months, Robert lost close to 30 pounds. His family was thrilled. His blood sugar numbers improved. His doctor was pleased with his progress. But around the 4th month, Robert's daughter noticed something. Robert used to carry the groceries in from the car without a second thought. Now he was pausing halfway up the porch steps. He mentioned his legs felt weaker than they used to, even though he was eating less and feeling lighter overall. At his next appointment, his doctor asked a few more questions than usual. Was he still eating enough protein? Was he doing any strength-based movement? Had anyone checked his muscle strength recently, not just his weight? This is a fictional example, but it reflects a very real pattern doctors are seeing more often. The scale said Robert was successful. His legs were telling a slightly different story. Let's walk through what current research and clinical guidance actually show, point by point. Point 1. Rapid weight loss, from any cause, can include a loss of lean muscle mass along with fat. This is not unique to these medications, but it becomes more noticeable with them because the weight loss can happen quickly and in larger amounts than many people are used to. Point 2. Research reviews looking at people using GLP-1 medications for weight loss have found that a meaningful portion of the weight lost, in some reviews estimated to range anywhere from around 15% up to 60%, depending on the individual and the specific medication, can come from lean mass rather than fat. That is a wide range, and researchers are still working to understand exactly why it varies so much from person to person. Point 3. Older adults are considered a higher risk group for this specific concern because they are starting from a smaller muscle reserve to begin with due to the natural aging process we just talked about. Point 4. This does not mean these medications are unsafe or that they should be avoided. For many people, especially those managing diabetes or significant obesity-related health risks, the benefits can be substantial. What it means is that doctors are increasingly recommending that muscle health be actively protected and monitored alongside the medication, not treated as an afterthought. Point 5. Clinical researchers are now studying structured approaches, including combining these medications with specific nutrition and exercise plans to help preserve muscle and bone while still allowing for meaningful weight loss. Let's go a little deeper into why this happens and who tends to be most affected. One reason muscle loss can happen more easily on these medications is that they work partly by reducing appetite. That is often exactly what someone wants if they are trying to lose weight. But a smaller appetite can also mean someone unintentionally eats less protein, and protein is the building block your muscles need to repair and maintain themselves. So, the very thing that makes the medication effective for weight loss can also make it easier to undereat the nutrients muscle depends on. The people who appear to be at higher risk generally include those who are already less physically active, those who already have lower muscle mass going into treatment, and those who lose weight very quickly, particularly at higher medication doses. Families are often the ones who notice the early signs before the person taking the medication does. That is worth remembering because it means loved ones paying attention to small changes, like needing to use armrests to stand or slowing down on stairs, can genuinely make a difference. It is also important to be honest about what the research can and cannot tell us right now. Much of this evidence comes from clinical reviews and observational studies, not long-term, large-scale trials specifically designed around this question in older adults. Researchers are actively running new studies in 2026 to better understand exactly how much muscle loss occurs, how to measure it more precisely, and which strategies protect against it most effectively. So, think of what we know today as a strong and growing body of evidence, not yet the final word. So, what can you actually do with this information? Here are conversations and habits worth considering, ideally together with your own doctor. First, ask your doctor whether your protein intake is adequate for your body weight and activity level, and whether it makes sense to spread that protein across your meals throughout the day rather than eating most of it at one sitting. Second, ask about incorporating resistance-based movement, such as light strength training, resistance bands, or bodyweight exercises a few times a week. This does not need to mean a gym membership. For many older adults, it can start with simple movements at home, guided by a physical therapist or your doctor's recommendation. Third, ask whether tracking your strength and function, not just your weight on the scale, makes sense for your situation. Things like grip strength or how easily you can rise from a chair can be simple ways to monitor whether you are maintaining muscle along the way. Fourth, and this is important, never stop or adjust a prescribed medication on your own based on something you saw in a video, including this one. If you have concerns, bring them directly to the doctor who prescribed it. They can look at your specific situation and help you get the benefits of the medication while protecting your strength. Let's clear up a few misunderstandings. Myth 1. All weight loss is good weight loss. Not exactly. The goal for most people, especially after 60, is losing fat while preserving as much muscle as possible. The scale alone cannot tell the difference. Myth 2. Only athletes or bodybuilders need to think about muscle. In reality, everyday strength is what lets people keep living independently, carry their own groceries, and avoid dangerous falls. This applies to everyone as they age, not just people who exercise for sport. Myth 3. You have to choose between losing weight and keeping your strength. Current guidance suggests this is not really an either-or situation. With the right nutrition and movement approach, many people can do both at the same time. There are certain changes that deserve a prompt conversation with your doctor rather than waiting for your next scheduled visit. These include noticeable new weakness that affects daily tasks, unintended weight loss that feels faster or greater than expected, increased trouble with balance or a sense that falls have become more likely, or simply a gut feeling from you or a family member that something has changed. None of these changes mean something is definitely wrong, but they are worth bringing up so your doctor can take a closer look. Let's bring this together with 3 main points to remember. 1. Rapid weight loss, including weight loss from GLP. 1 medications can involve losing muscle along with fat, and this matters more as we get older. 2. Protecting muscle usually comes down to 2 things working together: enough protein and some form of regular resistance-based movement. 3. These medications can still be genuinely valuable for many people. The goal is not to avoid them out of fear, but to use them wisely in partnership with your doctor, so you protect your strength while you protect your health. If you found this helpful, we would love to have you as part of this community. We focus on clear, honest health information made specifically for older adults and the families who care about them, without the fear and without the hype. If explanations like this are useful to you, consider subscribing so you do not miss future videos. And if you know someone who has started a weight loss medication or who is caring for a parent or spouse who has, please consider sharing this video with them. It might be exactly the conversation starter they need for their next doctor's visit. As always, this video is general educational information, not a diagnosis or a treatment plan, so please talk with your own doctor about what is right for you. Dr. James Carter is a fictional AI-created health educator, not a real doctor.